Okay, so we have prepped and we have draped. We'll take a look at the IgA anatomy here first off. We have landmarked this before we draped, but just sake of brevity and efficiency, we'll show you here what we're landmarking. Maybe we'll increase the depth a bit. There we go. Looking for a nice compressible round object. Okay, we are again on the right side of the neck. Ideally, we try to aim for a structure where the IgA is more lateral than the carotid. That way we prevent a through and through. In some cases, that'll be difficult to avoid. Okay, so let's use this to actually localize our freezing. Okay, so we found a suitable area to first anesthetize the skin with a smaller 25 gauge needle. So in this case, we'll just inject a couple cc's of lidocaine in the area. Yeah, you can place the tray either at your bedside or also in the patient's chest if they're comfortable. Okay, so we'll freeze the area first, like I mentioned. Again, lights, yeah. And here, again, we're not aiming to actually get in the vessel, just the overlying skin, just so it's comfortable. So even before you poke here, you just want to check to make sure that that syringe and needle are comfortable. They're not too tight. In some cases, if it is too tight on, then it's a hard time getting off. Perfect. That looks great. Now we'll place the probe on the neck and make sure that the vessel is in the middle of the screen and the needle is in the middle of the probe, aiming at essentially the middle of the vessel. About 45 degrees. And as we're injecting here, we're also aspirating to make sure if we actually get in the vessel. Okay, nice. We're just in the overlying tissue. Here we're using the creep technique to make sure that our ultrasound probe is always in advance of the needle. In some cases, you might need a sharp little limited jab to get inside the vein. Okay, so nice venous flash here. Now we'll stabilize the needle, remove the syringe, and then we will, in quick fashion here, insert the wire. Should go nice and smooth. Looks like it's feeding well. At this point in time, we'll take the needle out and we'll ultrasound the wire to make sure its placement is clearly endovenous. Perfect. That looks like it's in good placement there. This next step, we'll make a small incision right next to the wire and insert the dilator. So this is a dialysis line, so there are actually successive dilators. So you can see here, we'll start with the 1. Here's the first incision. Okay. Dialysis lines need a bit of an extra incision there just to make sure it can fit both successive dilators. Here you go. Good work on the successive dilators while also maintaining hemostasis. Okay. This is the final dilator, and then the dialysis line will go over this one. Sorry, once the dilator is removed, then the dialysis line will go in. Okay, again, the final dilation until the catheter is put in. Okay. Next, in sequence here, we'll pull out the final dilator and insert the dialysis line. Again, good job maintaining hemostasis. Okay, you have good control of the wire here. I see that. You're watching it at all times. You've never lost sight. This step should go on fairly smoothly. That's great. So that as the wire comes out, you've maintained that you have some, occluded that port to prevent air entrainment, given this is a bigger line. Now we're just going to secure the line to the neck with some with suture. So there's two caps placed over the end of this line. Those are just needleless caps to secure the ports. That way the ports aren't hanging open. So this line has a winged area which we can suture to both sides of the catheter itself to minimize the chances of removal. Okay, and then after this line is sutured in place and anchored on both sides, then we'll make sure to communicate with the nurse on whether or not this line needs to have citrate instilled into each port. But that's essentially the procedure for now. Of course, at this step, we would get an x-ray and make sure it's in the correct place and rule out the chance that there's a pneumothorax. Thank you for watching this tutorial on training for insertion of the dialysis line.